So would you be able to tell me a little bit about the therapies that are available for people with acute porphyria, please?
Yes. So all patients with acute porphyria need to take steps to try to prevent attacks. And the most important thing probably is to make sure that any medication that you take, and that means either medication that's prescribed by your doctor or that you buy from the chemist, you need to make sure that that medication is checked for safety in porphyria. And all patients should have an up-to-date copy of the porphyria safe drugs list. The other important thing is to be very careful about drinking alcohol. And for the most severely affected patients, we may recommend that you don't drink any alcohol at all.
Yeah.
As well as prevention, obviously, if you are unlucky enough to have an attack, there are some simple things that you can do at home. And sometimes if you can catch an attack early, you may be able to manage it yourself, and it may get better with some simple measures. So the first thing you should do is try to rest as much as possible. You should try to boost up your fluid intake and your intake of carbohydrates, so starchy and sweet foods. And often an early attack will settle down if you take some of these simple steps. But if things get bad, you may need to be admitted to hospital. And if you were admitted to hospital, we would give you medication to treat the symptoms of the attack, particularly to help with the pain and help with sickness. We give you some fluids into your veins, some intravenous fluids, and some other treatments. And in very severe attacks, we may treat with intravenous infusions of hemarginate, a particular drug which can help to end the attack.
Excellent. And for those people that suffer recurrent attacks, what kinds of treatments are available for them?
Thank you. Yes, so recurrent attacks is a nasty condition which can be very disabling. So for women with recurrent attacks, the first approach is usually, so particularly if in women, attacks are often driven by the hormonal changes of the menstrual cycle.
Yeah.
And in that case, our first approach would be to try to stop the hormonal cycle with a range of drugs. And in some cases, that's quite helpful. But probably the main treatment to prevent recurrent attacks, and this is useful in women and in men, is to use to give regular infusions of hemarginate as a sort of preventative measure. And we give these infusions at various intervals, sometimes every week or every 2 weeks or every 4 weeks. And this is quite helpful to try to prevent attacks happening. We do have another treatment. So in very, very, very severe cases where nothing else will help, we sometimes have to go recommend liver transplantation. This is really a final treatment if nothing else is effective. And this is effectively a curative treatment for acute porphyria.
Excellent, thank you. And a lot of people will have heard about the trial of givosiran. Would you be able to tell us a little bit about that in brief?
Yes. So givosiran is a new drug that's been developed in America, and it's been, over the last few years, it's been undergoing trials all over the world, including in the UK, and we have a few patients in the UK who are taking this drug now. And it's a drug which blocks the production of the chemicals which cause the problems in porphyria. And the early results of the trial, well, trial's quite advanced now, the results are really looking very promising indeed. So we hope this is a new treatment that may bring some relief to those few very severely affected patients with recurrent attacks. And this drug at the moment is just being evaluated by NICE and trundled through this process, and we hope if NICE is happy with it that they may agree to fund this on the NHS sometime in the future. It's not yet available, but we hope it may be soon.
That's very reassuring, quite promising. So Hemarginate, would you be able to tell me a little bit about some of the pros and cons of Hemarginate use in prophylactic use and for one-off attacks as well?
Yeah. Well, it's a very safe and effective treatment for an acute attack. So it will shorten the attack, and it will also reduce the risk of the complications, particularly the worrying complications like nerve damage and paralysis. And there is some benefit when it's used regularly to prevent attacks, but it's not so good at preventing as at treating. So the main benefit is for treating attacks. But there are some drawbacks. So the main problem with Hemarginate is that it can damage the veins that it goes into. So it has to be given intravenously. So if you put it into a little vein, like in the back of the hand or something, it can cause a lot of nasty inflammation. So for patients who need to have it frequently, or who have very small veins, or for anyone who needs to have it as a preventative measure, we would need to put in a form of central line. So for patients having Hemarginate regularly, we put in a portocath, which is a form of central line. But sometimes, even when patients go into hospital, we will recommend that the Hemarginate is given through either a PICC line or a temporary central line, just to make it a bit safer. Some of the other problems we see if Hemarginate is used for a long time, it contains iron, and so patients can accumulate iron in their bodies if they have it for a long, many years. And for patients having Hemarginate as a preventative to prevent attacks, it does unfortunately become a bit less effective over time, and it can be difficult to get patients off that treatment in the long run. It's a useful treatment, but there just are some drawbacks when it's used to prevent attacks.
Excellent, thank you.